Assistant Study Source. Today I would like to teach you some note-taking skills, specifically talking about the outline method. Now, if you just started school, if you've been in school for a while, or it's been a while since you've been at school, taking notes during your class, if it's hybrid or in person, sometimes can be a challenge, especially because we're not really taught on how to take notes properly. So we may just be confused, or we don't know what to write down and we feel like we're writing down everything. So one method to kind of help organize your material and help you understand it is to use an outline method. Now this can work for anything like anatomy or physiology. This can be used for administrative topics. It can even be used for clinical skills. I've seen my students use these for different topics, and it all depends on how you organize it. So using the outline method, what's going to be important is how you're going to go ahead and actually label each part. So for example, you want the big topic always to be first. Okay, so in this example, I'm going to put a clinical skill. I'm going to do an EKG, which we also know as an ECG, electrocardiogram. Now that is our main topic, so everything that goes underneath it is going to support our understanding about this. So by the end of this, I should be able to have a clear understanding on how to do an EKG, ECG in this example. So first, I'm going to say my purpose or my why. And essentially, everything underneath it is going to support this purpose or why. So this is essentially a cardiovascular procedure. It's non-invasive, and it measures electrical activity of the heart. All right. That is my purpose of why an EKG is done. It's part of a cardiovascular procedure, it's non-invasive, and it measures the electrical activity of the heart. On my next part, I'm going to go ahead and put patient prep. So I know what this is for. I can explain it to the patient. So part of patient prep is explain procedure. But also to get this patient ready for a procedure, I have to make sure that their skin is clean. So use an alcohol pad. I have to make sure there's no conductors. So that can be anything like removing jewelry, removing metals or piercings, electronic devices, right? Making sure my patient doesn't have anything on them that might affect this test. So making sure the skin is clean, I'm explaining the procedure, making sure nothing is going to cause any artifacts like conductors. I'm going to make sure that the equipment is working, of course, which also means I have to make sure I have my patient details entered correctly. So a lot of EKG machines will ask for their name, date of birth, name, age, date of birth. Sometimes it'll ask if they have a pacemaker on, so I may have to ask that question if they have a pacemaker, or look in their chart, or once the patient starts getting ready, like in a gown, the pacemaker is pretty visible. It may also ask for medications that they're currently on, or even refer back to a baseline EKG. So I want to make sure my equipment's working. I also want to make sure, and this will be my next point in my outline, and equipment, is that I have my 10 electrodes. Now remember, electrodes are the sticky tabs, or what actually has contact with the skin. That's why you want to make sure your skin is nice and prepped. If someone needs a shaven, you get a shaven. I want to make sure that my leads are not broken or stripped or anything. The leads are the actual cords that connect to the electrodes, either by clipping them or by little buttons that you press down. And of course, my EKG machine itself. Right, make sure it's turning on or that it's charged. Good. So again, my main purpose here was my EKG, ECG procedure This is why I would do an EKG, or the purpose of it. These are my sub-steps. You can even number them if you want. 1, patient prep. 2, equipment. And then 3, I may want to label this as the setup, right? Though it's not a difficult procedure, there are various steps to it that you want to make sure are done correctly, so the procedure is then done correctly. And I think one thing that confuses the students sometimes are the placement of the leads. This is a very poor drawn rib cage. So pretty much what I would do, maybe draw a picture or maybe use some kind of image and then recall where I need to place my electrodes, right? Like where does my V1 go? My V2, my V3, that's the only one that's on a bone, my V4, 5, 6, right? Those are my chest leads. Precordial leads is what they're called. V1 to V6. And then you have your limb leads, which goes on your arms and then legs, right? So maybe you, on your outline, you want to have a picture or a description of where your equipment is actually set up. So you might say something like V1 is on the right 4th intercostal space, adjacent or next to the sternum or by the sternal border. You might say, V3 is, halfway or midway between V2 and V4. You might say that, V6 is mid-axillary, 5th intercostal space, right? So you might want to just write the descriptions, or you might want to have pictures. Sometimes you can draw pictures or print pictures. There's really cool mobile printers that print 2x2 or 4x4 little stickers. Those could be beneficial in your outline. Okay, and then you have your topic, you have your purpose, and you have all these subsections to then explain the EKG, the ECG. And there's no limit on how many bullet points or how many numbered items you have. 1, 2, 3, you can keep going. You can even have subsections like patient prep, and we have all these additional subsections. You can have images, pictures. But again, in the outline method, what we're doing is we are supporting our big topic by breaking it down into smaller topics or smaller sections, so then we can see the big picture, which is the topic, and then the supporting details or the facts. So then we can make this make sense. And like I said, this could be used for procedures. If this was an anatomy or an organ section, then your outline is going to look a little bit different. It might be, cardiovascular system, and right here you might put, talking about the heart, another section talking about the blood vessels, another section talking about the blood flow through the heart or the conduction system, etc. Okay. If this was an administrative section, you might have something like, billing and coding, a section for ICD-10, a section for CPT, a section on how to, navigate through the books so you know when to look at the index and when to look at the tabular list. So using this method, if you like seeing the big topic, the purpose, and then the supporting facts, this is definitely a method for you to use. There are others that I will get to in some other videos, but I hope this was helpful. Thank you so much.